Good evening. Welcome to the 236th day of the Swasthya 365 Days project. Today we are going to see the diagnosis of pancreatic cancer. Detecting and diagnosing pancreatic cancer can be difficult, especially because the symptoms are not always obvious, often develop gradually, can be mistaken for other condition. At times, pancreatic tumors are found incidentally when a patient is being evaluated for another medical condition. If pancreatic cancer is suspected, there are a variety of tests a doctor may perform, including blood tests, imaging studies, or biopsy of a tumor. A physical exam will focus on the patient's abdomen. The doctor will check for masses of fluid buildup in the area near the pancreas, stomach, liver, and gallbladder and examine the skin and eyes for signs of jaundice. Since cancer can also spread to lymph nodes above the collarbone and other locations in the body, the physicians may examine the areas of swelling or other signs of metastasis. Urine and stool tests may also be ordered. The patient's history will be taken to pinpoint any risk factors and found out if any family members have been diagnosed with pancreatic cancer. Currently, there is no simple blood test to detect early pancreatic cancer. However, certain blood tests can support a diagnosis and help the doctor determine the best course of treatment. Firstly, you have the hepatic function. The test is called as LFT. The test measures the levels of bilirubin and liver enzymes in the blood. If there's a tumor blocking in bile duct and the bilirubin levels may increase, causing jaundice. CA1919 tumor marker. And the test measures a substance that is released in the bloodstream. The tumor of the body responds to the tumor cells. Carcinoembryonic embryonic antigen (CEA). The test measures a protein in the blood that may also function as a tumor marker. CEA is the best used to determine disease progression and treatment effectiveness, which is called as prognosis. Non-invasive imaging. Studies may order as well. The test may help determine if there is a mass in the pancreas, and these tests are critical in determining the patients are suitable in surgical candidate. Abdominal ultrasound. The machines used sound waves to examine body's internal organs, including pancreas, gallbladder, liver, kidneys, spleen, stomach, and intestine. Computerized tomography (CT), an X-ray machine linked to computer that has a series of detailed cross-section pieces. These are slides then taken together to create a three-dimensional reconstruction of the body. Unlike regular X-ray images, they show only the bone. CT images can show soft tissues as well as blood vessels. MRI. This patient can also use radio waves and powerful magnets to produce images of the body, like CT and MRI can provide a three-dimensional cross-section of the body of the pancreas. Magnetic resonance cholangiopancreatography (MRCP). A special kind of MRI enables to examine the visualize the bile and the pancreatic ducts in a non-invasive way. This particularly helps since tumors typically arise in ducts. Positron emitter tomography. It creates a scan PET. A scan creates an image based upon the metabolic activity of the cells in the body. The amount of radio-labeled glucose injected to the bloodstream, the glucose is taken up and metabolized by the tissue. Since cancer cells metabolize more glucose than normal cells, they usually light up more brightly in the PET scans. On cancer suspected, the basis of non-invasive tests, or if a patient has an unexplained jaundice, a physician may order for one of the more efficient tests. Endoscopic ultrasound (EUS) provides detailed images of pancreas and surrounding the tissues, including liver, blood vessels, lymph nodes, and high-frequency sound waves. EUS also provides a thin lightened tube called an endoscope that to the mouth is intended to your stomach and duodenum. An ultrasound probe is attached to the tip of the endoscope and get very close to the pancreas surrounding organs, producing detailed pictures of even the smallest tumors. A real-time needle is guidance provided by EUS. Procedure enables a physician to take a biopsy of the suspected tumor if necessary. A fine needle aspiration. This is called FNAC, fine needle aspiration cytology. This is safer than obtaining a biopsy to the stomach. To learn biopsy precision, endoscopic retrograde cholangiopancreatography (ERCP) allows the physician to visualize the pancreatic as well as bile ducts. This study is most commonly performed when a patient exhibits symptoms of jaundice and can indicate the presence of mass growing in blocking ducts. ERCP is an outpatient procedure. The physician passes endoscopes to the patient's mouth, through the stomach, and into the duodenum. A tube is called as a catheter, and then the endoscope and to the pancreatic and bile ducts. Dye is injected to the catheter and X-ray is taken. A spike glass direct vascular visualization system. It is a latest technology to visualize to evaluate pancreatic ducts. This device enables physicians to view a heart axis and ducts with greater clarity. Fine needle aspiration cytology or core biopsy. This is a method to detect a sample suspicious lesion with a surgical procedure. FNA biopsy of pancreas may be performed percutaneously or guided by EUS. The percutaneous approach is used to a local anesthetic applied to the skin, a long thin needle and inserted to the abdominal wall and pancreas. Imaging of form of CT or ultrasound guided needle placement to ensure tumor cells are gathered. In EUS and guided FNA, the physician uses live ultrasound images to guide the needle placement to endoscope directly into the suspicious mass. EUS guided approach is most frequently used in well-tolerated, provides accurate results regarding diagnosis. Brush biopsy. In this approach, a small brush is inserted through an endoscope during an ERCP procedure and directly into the bile duct or pancreatic duct. Cell rubs off onto the brush and then are examined under the microscope. However, the chance of getting a conclusive diagnosis by this method is low when compared to an FNAC. Laparoscopy. It is a procedure. A small camera is attached to a thin lightened tube is inserted directly into the abdominal cavity through a small incision. It is performed with the patient under general anesthesia. This means that patient completely asleep during this procedure and does not respond to any verbal or physical prompts. By manipulating the camera, the doctor can directly view the pancreas and surrounding organs. A tissue biopsy can be taken by passing a pair of forceps to the laparoscope. These tests help the physician determine the stage of tumor, whether or not it can be surgically removed. Thank you.